Hi, this is Dr. Abinaya. I am a doctor and a motherhood empowerment coach. Today in this video, we are going to discuss about thyroid disease in pregnancy. What are all the foods to avoid, what are all the symptoms you can have, and what is the treatment for thyroid. Let's get started. So thyroid disease in pregnancy is very common nowadays. That's the main reason why we do a screening of thyroid by thyroid function test in the first trimester of pregnancy. Though you don't have any symptoms, it is always to have thyroid function test as a screening tool early in your pregnancy. Because if thyroid in the mother is untreated during pregnancy, this can lead to congenital hypothyroidism in baby, which is life-threatening. First and foremost, there are two different scenarios when it comes to thyroid disease. One is hypothyroidism, another one is hyperthyroidism. Hypothyroidism means your T3 and T4 levels are low and your TSH level is high. It is vice versa. When this is low, the opposite one goes high. So when it is hyperthyroidism, the free T3 and free T4 hormones are high and TSH, which is the stimulating hormone, is low. We are mainly concerned about hypothyroidism, which is very common in pregnancy. So let us discuss what are all the symptoms regarding the hypothyroidism in pregnancy. 1. You may have irregular periods. 2. You may put on weight recently or in the recent years. 3. Constipation. 4. Sometimes you will have a cold extremities, which means when the fan is switched on, within some time you feel very cold and try to switch off the fan. That is also a symptom that you might have hypothyroidism. So when you have such symptoms, it is always better to consult your doctor to get it checked. If you are pregnant, even without the symptoms, always go for a screening thyroid function test in the first trimester itself. So when you do a thyroid function test in the early first trimester, and if the TSH is found to be more than 3, you would be probably started on thyroid medications, which is L-troxin, thyroxin or Thyronorm. Whatever name you call it, the medicine is the same. So you're going to take it regularly throughout your pregnancy and you're going to follow up with the thyroid function test maybe once in 3 months or once in 2 months during your pregnancy, so that we are sure that your thyroid is brought under control after starting medications. If the thyroid is not controlled properly or if the thyroid is left unnoticed, this hypothyroidism can lead to congenital hypothyroidism, as I've told earlier in this video. So this is going to be a life-threatening condition for the baby. So anytime if you find hypothyroidism in your pregnancy, do not hesitate to start on your medications, but do start it promptly and take it throughout your pregnancy without missing a day. The tablet dosage will be somewhere between 25 micrograms, 50 micrograms, 75 micrograms or 100 micrograms. So starting with 25 micrograms, we need to follow it up and it will be revised according to the thyroid values. And the best news about hypothyroidism in pregnancy is most of the cases after 8 weeks of delivery, the hypothyroidism comes back to normal values, which means we can stop the medications after testing 8 weeks post-delivery. If the values are normal, we can stop the medications. What are all the foods you need to avoid for hypothyroidism? Number 1, broccoli. Number 2, cauliflower. Number 3, cabbage. So these are the foods that you need to avoid during your pregnancy if you are diagnosed with pregnancy-induced hypothyroidism. Having said this, if you are a known hypothyroid patient and you are on medications even before your pregnancy, it is always advisable to check it during the early weeks of pregnancy and follow it up so that at any point of time, if you need titration of the dosage, you can be leveled up so that the thyroid levels are maintained throughout your pregnancy. Hope you found this video useful. If you would like to watch many more videos on pregnancy and motherhood, do hit that subscribe button and press on that notification bell icon so that you don't miss out on any new videos in my channel. Until I meet you in the next video, stay happy, stay mommified.